Welcome back. For this week's Mending Monday segment, I'm joined by Emily and Sarah from our sponsors at Save the Michaels with details on how they provide critical resources for the most vulnerable members of our community. Welcome, ladies. Thanks for joining me.
Thanks for having us.
Of course. Can you first tell us about your Lockport facility and the programs you have available there?
So our Lockport office is a recovery center. We have recovery coaches that work with peers that are working on recovery, as well as like their families and loved ones, because we all know families need support too. We have about 50 to 60 groups that meet each month, going from like NA, AA, Celebrate Recovery, Women's Group, things like that. We do also have our syringe exchange, which offers clean syringes, wound care, safer sex items, harm reduction items. And then we have our drop-in center, which is everything is Monday through Friday, 9 to 5, and our drop-in center has laundry, bagels, coffee, case managers, Wi-Fi, TV, various things to help people who are unsheltered.
Okay. Now, people in Buffalo might not be aware of how prevalent homelessness is in our community. So can you give us an idea of what unhoused individuals may need for their recovery process?
I think the homeless population struggles with a lot of barriers. At Save the Michaels, like Emily mentioned, we do have the drop-in center, which consists of, a warm place to come into in the winter, a cool place in the summer. They don't get a lot of, adequate nutrition. We try and provide, fruit when available. We get donations from Panera. We also have our new Honey Case Management program within the drop-in center, where we can assist those individuals with linking to different services and providers when they do agree and they're ready to get some help.
Yeah, let's talk more about that drop-in center and how it works.
So again, it's open Monday through Friday, 9 to 5. Anyone can come in. We have them sign in, often start with a participant packet where they just agree to some of the rules and we get some of the basic information. Then we have a couple outreach specialists who work there that'll greet them, introduce them to staff. Then we kind of let them hang out, just get to know us. Sometimes they'll sit for a few days or even up to a week and just kind of test out the waters. And then we will link them with recovery coaches, offer to do their laundry, get something for them to eat, those kinds of things. So again, it's Monday through Friday, 9 to 5. Anybody's welcome to spend some time. We work closely with the Lockport Cares Homeless Shelter, and a lot of the individuals who spend the night at Lockport Cares will use our facility as a day program and go back and forth. It kind of works as a very good collaboration.
How are we helping these unhoused individuals to figure out a different path to get them into housing, get them into careers so that they don't have to stay through this program?
So like I mentioned, they do often come in and kind of feel us out a little bit, because a lot of times if you don't have safety, you don't have people that you can trust, people have let you down, people have stabbed you in the back, you haven't had a good night's sleep, you haven't eaten, you're not necessarily ready to jump in and start a recovery plan.
Right.
And so we do pride ourselves on meeting people where they're at, letting them just kind of hang out, get to know us, spend some time with us. And then again, we have that syringe exchange, so if people are still actively using, we're there for them. The idea of that is just to reduce harm, reduce risk, and reduce spread of disease. And then as they get comfortable with us, knowing that we are there to meet them on their journey when they're ready.
Let's talk more about that harm reduction, because I know that that is something that it does polarize people in a way. Can you talk more about really what you're trying to do and why it's important, the impact that it's having in a positive way?
Yeah, so I understand the polarization. I myself am 6.5 years sober from alcohol, and abstinence is what worked for me. And so when harm reduction came in, there was a part of me that's like, well, how come certain people get certain things? Like as an alcoholic, my journey didn't really go towards harm reduction. And then I realized probably about 2017, 18, I was in the field for a couple of years and people were just dying left and right. And when what we're doing isn't working, we have to rethink and try new things. And that's what we're doing right now in the substance abuse field, is we recognize like people do have to wait until they're ready and they want to change. And what can we do to keep them alive and reduce the risk during that process, build trust, and then maybe they're willing to have that conversation. We also know that there are going to be individuals who don't want to get help, and we are still there to support them and love them, because oftentimes they are set aside.
meeting people where they're at is important to what Save the Michaels does. And it's a judgment-free zone, and it's literally about keeping people alive. Like you mentioned, no one can get the recovery they need until they are ready. No one in your
Right.
family can make you want that recovery. No one around you, loved ones, it has to come from you. So until you're ready, let's make sure you're safe, right? That's kind of the idea behind it. But breaking down those barriers for people is what Save the Michaels does too. I mean, even when it comes down to transportation, right?
Yeah, so out of our Buffalo location, we have our transportation team. You do have to be in recovery linked with an outpatient clinic, and then you can call in and request transportation. Very new to Lockport, we do have a vehicle now for those that are linked with our case management service. We can meet people at appointments. If they're in the hospital, we can meet with them. If they need transportation to an appointment, our case managers will go with them, and we found that that's really effective too, because transportation is a huge barrier.
Absolutely. Well, thank you so much, ladies, for coming in and sharing more about what you do at Save the Michaels. And viewers, if you'd like more information on how our sponsors at Save the Michaels are mending our community, you can visit SaveTheMichaels.org. Thanks again for coming in.
Thank you.